Hello and welcome to the Raw Fork podcast. I'm your host, Dr. Marina Buksov, and I'm a functional medicine pharmacist in New York, as well as an integrative health coach and clinical herbalist. I'm pleased to go into season 3 of this podcast and continue to bring on other holistic minded pharmacists as well as healthcare professionals to the show. I'm constantly inspired by my guests and their stories and love sharing their points of view with you all. Hi, good morning, and welcome to Raw Fork Podcast. I have with me today an esteemed guest, Dr. Emily Kulpa. She is a pharmacist and a specialist in psychedelic medicine. So welcome to the show, Dr. Emily.
Hi, Marina. Thank you. Thanks for having me on the show today. I really appreciate it.
Yeah, I'm so excited to chat with you this morning. I have so many questions bubbling up. So first of all, why don't you, in your own words, introduce yourself to the listeners, maybe say a few words about where you grew up and why you chose pharmacy as your profession.
So I'm born and raised in a suburb outside of Milwaukee, Wisconsin. That's where I'm located today. And I got into pharmacy, it was in high school. It was kind of like a really good career choice back in I think around like 2004, 2005. I did a job shadow actually at Walgreens. And I thought, oh, this is really cool. And so I've spent a long time in pharmacy. I started working as a pharmacy tech my senior year of high school. So that kind of started, my path into my pharmacy career. And my pharmacy manager at the time she was a woman. So that was really awesome to see so many women in the pharmacy industry. And, they said, hey, it's a really great career too, because you can do part-time. There's a lot of part-time opportunities, especially if you want to have a family and, it's pretty secure. There's a lot of job opportunities and whatnot. So that kind of started me on my pathway. So I have a bachelor's of science in biology from the University of Wisconsin-Madison. And then I did my doctor of pharmacy at Concordia University here in Wisconsin. And I spent a lot of time in retail. And then really, I think my API rotations kind of opened up my eyes to a lot of different things, especially like integrative medicine, functional medicine. After graduation, my last API rotation was at a managed care organization. So someone had recommended, hey, you should check this out. It's something completely different than retail, hospital. And so I created a job for myself after that rotation, like, hey, I could really do this for you. And so that's where I started my clinical pharmacist position once I got my license right out of pharmacy school.
Oh, wow. Yeah, I can definitely draw a lot of parallels to myself. I was also recommended the profession because of the same reasons that you mentioned. And, it has panned out to be true for all of those reasons. So I really appreciate those aspects of it. So how did you manage to get a clinical position right out of pharmacy school?
So I feel like the APIs were really important. I know a lot of people at my school just kind of, I don't know, they kind of like let the match or whatever happen and didn't really like create their own. And what was cool at my school, we were a little bit newer, but you could go and like find anywhere and do a rotation, like wherever you wanted.
Oh, wow.
So I set mine up. So I ended up doing a rotation at a pharmacy. It was an independent pharmacy. Both of the pharmacists also had their clinical nutritionist like certification. So I learned a lot from them. I did 12-week rotation out in Hawaii at an independent pharmacy where they had a naturopath on staff, and I learned about CBD. And so that was a really awesome experience. And then my last one was the managed care rotation, and we focused a lot on medication therapy management. We did a lot of comprehensive, medication reviews with managed care organizations. They're focused on the star ratings and adherence programs, and so it was completely different. It was in an office, but you still have patient contact. You're doing it just over the phone, and then I kind of just saw that they had a need that they needed to kind of meet their numbers, and was like, hey, I could do a grad pharmacist internship if you want. And then they're like, okay, yeah, that would be helpful until we get another pharmacist. And then once I did that and got licensed, I was like, hey, I can just be, if you need this fourth quarter push clinical pharmacist, that's something I'm open to. And so just kind of throwing out ideas, creating positions, and they're like, they saw what I can do and hired me on. So yeah, it was awesome.
Wow, that's really great that you were able to create those positions for you. Like you mentioned, that your school encouraged that, which is really admirable. And then you went ahead and ran with it and did your own thing, no matter where you ended up. Yeah,
Yeah.
I really like that. So what did that entail, like that kind of clinical role, and like what did that teach you, and how did you then transition into what you're now passionate about?
Yeah. So on my API rotations, I was really introduced to a lot of different things like drug-induced nutrient depletion, things I didn't, I feel like we didn't learn about in school, or
Mhm.
we didn't learn a lot about it. And, about adaptogens, herbs, alternative healing modalities, working with the naturopathic doctor and just seeing all of the different things you can offer people. And then in my clinical role with the adherence program, we have a lot of patients who have chronic diseases, diabetes, hypertension, high cholesterol. And when I talked to these patients, it really seemed like they needed more education about nutrition and preventative and lifestyle medicine. And as we all know, a lot of these diseases, most of them can be prevented, by lifestyle changes, diet, exercise, all of that. And yeah, they weren't getting that education. It was more about, making sure they took their medication, filling it on time, which, medications have their time and place, are important. But I started to see just how many medications people were on, and, reading about like deep prescribing, and just how I feel like that's important with lifestyle medicine. And to me, I felt like that was the best way to help patients. However, I wasn't able to do that. I don't think a lot of people maybe put value on lifestyle, education and lifestyle medicine, because you can't see the benefits right away.
Mhm.
It's kind of like a long time thing. It's a lifestyle change. It's a commitment. So you don't see the money right away if you're a health organization. So, and then also, I was looking around, and we see the mental health crisis. So I'm always searching and doing like self-research on like what other options are there.
Mhm.
And that's kind of how it brought me into psychedelics. Was I stumbled upon the research, and I was really intrigued. And when you look at the data and the research, I think there's more research and data collected on psychedelics than there is on cannabis. So, and if you look at the research and the data, these molecules or compounds are pretty safe and well tolerated in a generally like healthy population. Um, and so I started doing some consulting work for this group at the University of Toronto. They've done a lot of microdosing, like observational microdosing research, where they kind of send out surveys and have people self-report. I got involved with them because they wanted to do a phase 2 clinical trial, psilocybin microdosing versus placebo, just to kind of see if that would have any, statistically significant effect on mood. So that's how I started it, kind of like got into the psychedelic field. After I read up on the research, I kind of got involved with them and helped them on their application to Health Canada. So I really had to self-learn. I didn't have any specialized training in psychedelics or in clinical trials. It was all just, kind of self-taught. You have to look at all of the things the FDA require, all the things Health Canada required. And I just read as much as I could about psychedelics, all of the peer-reviewed journals, any clinical protocols I could get my hands on, all of the investigators' brochures, anecdotal reports too, because people have been using these substances for a long time, and so that's kind of where how I started. And then eventually I went to an international conference in Berlin. So they had psychedelic researchers and advocates from all over the world come. And it was really cool to see people present all of the research that's going on all over the world on psychedelics. And that's how I met the company that I'm consulting for now.
Wow, wow, so many interesting things to dissect there. So can you talk a little bit to why you feel that the mental health piece in the public health spectrum is so important, and why you were researching it in the first place, and then what you think about psychedelics and how they can benefit mental health?
Yeah, I think definitely for personal reasons and also seeing everyone around me. So for me in undergrad and in pharmacy school, I personally struggled with depression and anxiety. And, I think to destigmatize it, you have to talk about it. And I haven't talked about it. But then, I was feeling frustrated because I think when you go to the healthcare provider right away, here, take this SSRI, here's a pill, take
Mhm.
this, nothing about meditation, not really talk therapy, CBT. Like I wasn't offered any of that when I went to go check in with my primary health care provider. It was like, here you go, here's a pill, try that out. But what if that doesn't work? And then, once I started talking about it, I kind of found out that everyone else around me is struggling with the same things and also are on like antidepressants. And, you would never think unless you talk about it. And then just seeing all of the patients that came through and how they were on it had really bad side effects. Maybe it wasn't necessarily working for them. So I'm like, wow, like what is going on here? And a lot of it too, like a lot of healthcare professionals, a lot of other pharmacists struggle with the same thing. So I'm, I think, learning about the integrative approach through my appies, I'm like, there's got to be something else. There's got to be some other way. And so, yeah, that's how I kind of ran into the psychedelic research that was going on. And I think, I think it's so important because like how they work, the mechanism of action is completely different from antidepressants. And it's interesting because it's like I think a lot of people, there's a stigma on psychedelics.
Mhm.
And I think it's just because, people are afraid of what they don't know. And I think we were kind of fed this story that, because they're illegal, that they're bad. And I mean, that's what I believed. In pharmacy school, it's like people get addicted to these drugs and they kind of just categorize psychedelics along with heroin, cocaine, and everything else, you know. But if you
And
look at
cannabis
the,
was in that group a short while ago.
what was that?
Cannabis was also in that stigmatized group a
Exactly.
short while
Yes.
ago. And look at it now. It's like the number one talked about, heal all remedy. Now everybody, and their mom and their grandma is using it. And it's, almost reached that legal status nationally.
Yeah. So, and I mean, these compounds have been used for, a long time, and like traditional healers use them. And so I think it's a really important step. I think this is like a reemergence. I think in the last maybe 20 years, there's been a lot of research done. And I think we just really need to look at the data and the research behind it. And we'll see that if you look at the data and the research behind it, they seem actually to have like less risks than things like alcohol and tobacco. So
And some
um,
antidepressants.
exactly, and some antidepressants. And I didn't even know this, but at the conference, um, there is a manufacturer who's manufacturing GMP psilocybin. So that's like the compound from the magic mushrooms. And I saw them present at this conference, and I didn't even know this, but there is a report called the STAR-D report. And so they looked at like SSRI treatment, and they found that for people who had depression, who were put on an SSRI, like 1/3 of them, went into remission, but the rest of them then did not. And so when they followed up, they found that in some people, and those like 2/3 and the other set of people, that being on these antidepressant medications actually led to chronic depression. Like it made it worse for them than if they would have never been on it in the first place. So it was interesting to see this data and some of this research kind of come out. So
Yeah, it's very odd when you think about like that the number one warning for SSRIs and other depressants is an increased risk of suicide. So it's
yes,
very much counterintuitive because exactly what you're trying to prevent is the number one dangerous side effect that you need to be wary of and be very cautious when starting an antidepressant. And also when tapering on and off different doses or coming off it or switching, you have to be really careful in the dosing, structure and schedule. And I think a lot of people don't realize that this is also a commitment of sorts. Like, this is, you're dealing with your neurotransmitters. So you can't just start something and then quit it cold turkey. Like, this is a big commitment that if you're going to go on it, you have to stay on it, first of all, for 4 to 6 weeks to see if it's even effective, because your body has to normalize and balance itself out and get used to this new level of serotonin and norepinephrine and dopamine and whatever other things are also triggered. And our limited view and knowledge and studies of our human biology is just that, it's limited. We can't see everything. So theoretically, while we think we know what we're doing and we've designed amazing drugs to help us with everything, under the rainbow, but in reality, your body's always trying to bring itself back to homeostasis. It's always trying to balance itself. So once you put something exogenous in, there's unpredictable things that are going to go on while your body's trying to metabolize it and assimilate it and then get back to balance, because it's always communicating back to itself and trying to figure out, okay, let's raise this, let's decrease this, because we need to be centered.
Yep. Yeah, I completely agree with that. I feel like we act like we know so much. And then when you look at some of the mechanism of actions of some of the drugs, it's like, well, it's unknown.
Right.
Like that's a thing, it's unknown, but it works in this population and that population. So yeah, it's really interesting. And with psychedelics, if you just look at it like another medicine, so far the research is showing improvements in, people with depression and anxiety, and they're researching it for things like addiction. They're researching things like MDMA for trauma and PTSD. And so I think what they're thinking, and I think they don't even really know exactly how it works. I mean, we know it hits the 5-HT2A receptor in the brain. That's like the main pathway, but then they also induce like neuroplasticity, which means that it kind of can rewire your brain, and your neurons can make new connections, and kind of reorganize the pattern in your brain. And so they're thinking, is it due to that? Can you now kind of have these new pathways and think about your life in a different way? Or is it people sometimes get these mystical types of experiences? Is it from the experience that you have when you take a psychedelic that kind of changes you, which can help improve, your mood, depression, anxiety, your overall outlook on life? So
yeah, from my understanding, it has a lot to do with dopamine also. And we know, like, the more dopamine a person has, the more they're likely to experience hallucinations. And it's also the feel good effect. And it could also cause things like addiction and tolerance and things like that. But if somebody just physiologically has too much dopamine, often they can get diagnosed with schizophrenia and other psychotic type of disorders. But there's always like that delicate balance of raising it too much. And then if there's too little, then you can get something like Parkinson's. So how does the psychedelic medicine work in your understanding exactly from your research? And can you also explain the microdosing versus traditional using of psychedelic plants?
yeah, so I think from my understanding, and again, we categorize all of these things as psychedelics. So I think when I talk about psychedelics, I'm hitting the traditional things like, psilocybin, LSD, and I guess I'll categorize like MDMA. It's not really a psychedelic, but it's kind of, being studied for PTSD and trauma. And so, like for the classic psychedelics, I think it's mainly through the serotonin receptors in the brain. And then those kind of, can affect things like, dopamine and other, neurotransmitters in the brain. And then also the neuroplasticity, so these compounds can create changes in the brain too. I think it kind of helps when you look at some of the research. It leads to people feeling more open, So I think maybe they're more open to change. So, but that's like the primary mechanism of action is through the serotonin receptors, 5-HT2A, and then it hits a couple of other ones depending on if it's, LSD or psilocybin or, what specific compound it is. And so with the microdosing, I feel like there hasn't been a lot of research done around the microdosing. It's more anecdotal reports of people taking, it's like a very, very small dose of the psychedelic. So let's say like a high dose of psychedelic, something that they would use in the clinical trials, like at Johns Hopkins or the Imperial College of London would be, I think for like pure psilocybin, maybe 25 milligrams they're using. And so a microdose would be something like 1 to 3 like milligrams. So maybe like 1/10 to 1/20th of like a typical dose. And so for the microdosing, people report like improved mood. They also report improved concentration, attention, an increase in creativity. However, some other people also report things like anxiety, that they weren't able to like function normally. You've got to be careful because, with the microdose, you want to take it so that would improve like your mood and your creativity, but not alter your ability to function. So if you take too high of a dose because, it's a psychedelic, you can, hallucinate, and it kind of changes your perceptual experience. If you take too high of a dose, you're going to kind of trend towards that way. So I think most people use microdosing more for like well-being, improved mood, but there's not a lot of evidence right now. There's no like, a randomized controlled trial is the gold standard, and there hasn't been anything like that to show that, statistically significant, that this stuff is statistically significant to improve mood or any of these other measures.
So what would be the difference in the standard dosing versus microdosing as to how frequently or how often you would have to take this medicine to see an overall improvement? Like, is it also treating the symptoms, or is this treating the cause of, let's say, depression?
Yeah, I think with microdosing, there's no studies, I guess, to show that it's, correlated with treating depression. I think a lot of the studies are showing that people self-report that it improves their mood, improves their attention and creativity. I think there are a couple of different dosing protocols. Like there's like Fadiman's dosing protocol. So you take it for a couple days, then you go off for a day, and you kind of can repeat it. I think, people do it for a couple weeks, maybe for a month. It all depends. Everybody kind of does, can do a different microdosing protocol. But again, I don't think everybody's, a good candidate for microdosing or for the full dose. So that's why harm reduction is really important. That's why we have a whole screening process to make sure, the right people who go to retreat or, in the studies are getting screened appropriately. And then, preparation for a high dose is really important. And then integration is really important. So I think for the microdosing, it's like a small dose that you would take more often. And for the high dose, it's, I think you would go in for a session, they would prep you, and then you would have, the session with the psilocybin with the psilocybin. And then the next day they would do like an integration session. And so I think for that, they haven't really, I think, found what, like how often you would have to do a high dose. Would you do it, sometimes they would do like a moderate dose, and then a couple days later, a high dose. And then after that, we don't know, would somebody need to come back in 3 months, in 6 months? When would they need another dose of it? And that hasn't really been studied.
Yeah, that's always a really good question, because if you're taking something therapeutically, you definitely want to know how frequently to aim for the next dose, and would the effect wear off over time? How long does the effect last? And how often to to follow up with the patient to see if they're still getting the benefit from the previous dose, or is this something that you have to take consistently over some time and then get off completely, or is this something you might have to do every once in a while to just upkeep the effect? So I always like to kind of figure that out. Because I
Yeah.
think, I work a lot with plants and herbs, and how I think about it is, well, we need to eat plants to live, right? Like, we're not just going to eat one day and then for the rest of our lives, we're not going to need to eat. We always need to eat because we always need to have this fiber, all the macronutrients, all the micronutrients for our bodily functions. And so we always kind of need to replenish and then metabolize them and, get them out of the system, take what we need and discard the rest, right? So with plants, what I tell my clients is the same kind of thing, that sometimes you would have to take it for a short while or a little longer while, and then eventually you would be able to function without the plants, and the plants will kind of just help process whatever like blockage or whatever we're working on, and then we won't need to do it. Or sometimes we would need to follow up once in a while and do a similar protocol, or maybe do a smaller version of that protocol to kind of just like maintain. So like the first few sessions are usually more intense, and you might have like a more complex protocol with plant medicine, and then after that you just kind of need to do some maintenance and check in with yourself to see how you're feeling. If you're feeling fine without plant support, great, but sometimes you just need to turn into like some more nutrients, some more superfoods, and some more plants.
Yeah, I agree with that, and I also think it's an individualized approach too, right? Or at least I think so, because everybody's different. And so, I mean, the research has shown after 1 to 2 sessions that psilocybin for depression, the effects can last up to 6 months. But of course, that's not true for every single one of our participants. So, some of them the effects wore off earlier, some of them it was more prolonged, and also like everything else, psychedelics, it's a tool. It's not a magic like cure. It's not a magic fix, what we're all looking for. So I think with psychedelics, every day you still have to put in the work if you want to heal.
Mm-hmm.
You need to exercise, you need to do some movement, you need to eat healthy, cut out processed food, the sugar, do some meditation, have some time that you're sitting in stillness, kind of just, reflecting, and journaling. And those are things that I do every day to help. So I got to get some movement in. I try to eat healthy, a plant-based diet. I do low carb. I try to stay away from sugar, even though I really love sugar. So that's hard to challenge, but I just feel so much better when I do that. I try to meditate for a little bit every day, or just kind of sitting in stillness and in the nature if I can get outside, and journaling. And so all of that stuff kind of helps me. I feel like it's preventative. It's stuff I need to do every day to, keep my mental health to keep my mental headspace, in a good place. And so I think with the psychedelics, yeah, these are amazing medicines, but we also have to realize that every day you still have to put into the work. And I think the psychedelics can hopefully catalyze that change to kind of inspire you to make the changes, in your life that you need to make to live a healthy and a fulfilled life.
Yeah, absolutely. I totally agree that it's not just that magic, solution, which is what pharmaceutical medicine is all about. It's, making it easy for somebody to get access to feeling better with a pill. You just take a pill and you'll feel better, and you won't have the pain or the worry or the anxiety anymore. I think it's much harder to actually look inside and see, why are you feeling this way, and address, past trauma or childhood. A lot of the things that we, as adults suffer with is some kind of subconscious or repressed stuff that we haven't dealt with from childhood. And so, to just sit down and address all of that, and hopefully have some guided professional and talk therapy along with that, and then just really look in and see what would make you happy, and kind of just tune into yourself, because health is not just the absence of disease, right? health is,
Mhm.
what would make you feel joyful and what would make you thrive in your life. And, you know, the way we are living now in offices and four walls is not really how we co-evolved to live with nature. So what you're talking about, you know, spending time outdoors and breathing and journaling and slowing down, like we never lived in this fast-paced environment of just electronics everywhere and all these messages coming into us. So the act of just slowing down and getting in touch with our physical body by movement and exercise and feeding ourselves with proper nutrients that aren't hyper processed and, you know, all these artificial sugars that act like hidden um, addictive substances that also hit your dopamine reward center and have you, you know, come back for more with all these inflammatory processes that it causes. And so just kind of slowing down, getting back to basics, and, you know, having our basic needs met, and then looking inward to see if there's something from the past that we need to resolve and what we would like to see in our future and how we can actually merge that ideal self with who we are right now, because a lot of times we just follow like what the status quo is and we don't really recognize that it's out of sync with what we as a person, as an individual, actually want out of life.
Yeah, I completely agree with that. You know, I feel like, yeah, as a society, our productivity is increased. Yeah, you have text messages, notifications, all of these things kind of, vying for your attention and trying to keep up with, yeah, career goals and all of this. And yeah, for me, I have to every now and then kind of come back and focus on like what really matters to me. What do I really want out of my life? When you're working, you're trading, your time for money. And so for me, I really want to do meaningful work. And that's why I made the transition from the managed care organization over to psychedelics, because as much as I loved talking to patients one-on-one, and working with them through that, I just felt like with psychedelics, I have a personal connection. And I feel like this could really make a big impact in the future on, for people who have mental health issues. So I'm really excited about it. And I feel like I'm doing something that's meaningful. I enjoy it. Yeah. And I think that's other a piece of the puzzle is, meaningful work. Do you find meaning and purpose in what you do?
Absolutely. A lot of us, I think, trade in our time for money, which can then buy us anything that we want. And that's what we tell ourselves. But if at the end of the day, you're not feeling joy and you're not feeling rewarded for your job and you feel like you're not making a difference and your work doesn't matter, I think that's a very deep wounds that a lot of us are carrying around and don't realize it because we think that, you know, money will be the answer to our happiness. But in reality, I think meaning is the real answer, like bringing meaning into the world and to serving others, and which will in turn serve you and allow you to feel worthy and, you know, meant to be here and do the work that you're doing.
Yeah, yes, I like that meaning. I also think relationships, with my friends, colleagues, with my partner, and family and life experiences. So one thing that it always kind of boggles my mind is I love to travel, and I really started traveling after I graduated from pharmacy school. It was something I wanted to do. As I took a trip to France when I was 16, but then I hadn't been back to Europe since. And so I told myself before I took the clinical position after graduation that I took a month and I traveled to Europe. And people looked at me like, oh, I wish I could do that. I wish I had the money. And I'm like, I think it's priorities, because a lot of people, graduate and they buy a new car. I've had my car for the past like 11 years. I kind of live a minimalistic lifestyle, because to me, like traveling and having these experiences, you know, meeting new people, trying new foods, that to me, I mean, yeah, that's what I like to do. It's one of my passions. And I feel like people can do it. It's, you know, do you really want to do it? Is that one of your priorities?
Yeah, absolutely. That's such a good point. It's we always have these excuses at the get-go and like we sometimes can't help but be envious or jealous of somebody else's lifestyle. But if we just prioritize the same things and move our schedules around, or at least not be afraid to ask for it. Like, I'm going to bring you as an example. You know, you wanted the clinical pharmacist position, and you wanted to actually run or help consult somebody that's doing a clinical trial, and without any prior experience, you just asked and you said, you know, here's what I can do, I'll study the rest, and you know, take me for this position. And you created those opportunities for yourself. So a lot of the times, like, if we don't ask, we will never receive. So make it a priority for yourself and say to yourself or journal it, you know, out out on some paper, and figure out that, okay, this is what I want. Unless you kind of envision that or and put that out into the universe, then how will it ever happen if you don't like envision it first? So, and after that, you can actually make moves. You can't just like wait for the universe to give it to you. You actually make moves and look for either an opportunity, or ask around if that opportunity exists, or ask your boss if you can work remotely at least part of the week, or do like different hours. I mean, right now we're all having to work remote. So I think right now, hopefully after this whole pandemic is over, we will realize how much work we can do remotely. And this will open us up to actually free our time to whatever other desires and priorities we may foresee for ourselves. So even though our world is very complex and has a lot of stressors, we can work around it, and we can ask for what we want, and you know, say no to things that we don't want.
Yeah, I think that's great advice. I mean, you never know unless you ask, and nobody knows what you want. So, you know, you need to make it clear to the people who can help you achieve those things. And I think generally most people want to be helpful. You know, you feel good when you help people. So, yeah, I think asking around is great advice.
Yeah, so I also want to follow up on what your role is currently at your company and how you found that role. I think it's a Netherlands company, right? It's a company in.
Yeah, so the company is based out of the Netherlands. And so in the Netherlands, psilocybin truffles are legal there. And so you can walk into something called the Smart Shop, and you can just buy like a box of truffles for like,
Similar to like a cannabis dispensary, I would imagine.
um, yeah, I guess if it was like recreational cannabis, yeah. And in the Netherlands too, cannabis is recreationally legalized. So you can just walk in and buy, yeah, like a pre-rolled joint, or, you know, you can buy cannabis, and you can actually go and they have places where you, like cafes, they call them coffee shops, and you can just go in there and, you know, smoke your cannabis. So yeah, and then they also have the smart shops, which has the truffles, and that's like so it's not the mushroom, but it's the part of it that's like underneath the ground.
Mm-hmm.
So yeah, and so they have a retreat where they do legal psilocybin, you know, like a ceremony at these retreats, and it's mostly focused on healthy people who come for like an increased, you know, like well-being, and to kind of work on themselves. So a lot of people come because maybe, I don't know, there's a period in their life where they want to make a career transition or some insight, and that's something that psychedelics can offer for people. So what I do there is I help with the screening process, because like I said before, it's not a good candidate for everyone. So you have to look at stuff like, you know, cardiovascular risk, medications, you know, the mental health, family history. So there's a couple of things you need to evaluate to make sure they're, you know, a safe candidate to come. And with all the new research, and the FDA has given, I think they fast tracked, gave them designated drug status to two companies in the U.S., one for MDMA and one for psilocybin, to kind of get these, you know, approved for depression and anxiety. So we want to do the screening to be careful of who they allow to come to the retreat, because you know, we don't want to like take steps back forward in this psychedelic movement at all. So they're pretty careful and, do a thorough screening. And so I help kind of oversee that, help kind of design some of the screening questions, work on protocols and anything else that, I can do as a pharmacist for them to, it's mostly to help ensure like the safety of people who come.
So all the data that you collect, is it considered post-marketing data, or is this something that you're doing like pre-clinical or clinical trial-wise? Is this like totally legal there and then you're just like doing surveillance, or is this something for it to get another indication, let's say?
So the company in the Netherlands, it's just a legal psilocybin retreat center. So that's all that is. But the stuff I was doing with clinical trials and data collection was with the University of Toronto in Canada. So it's kind of two separate things.
Okay.
Yeah.
So the Toronto studies were then clinical studies. It wasn't post-marketing surveillance.
No, it was not post-marketing surveillance because none of it, psilocybin and MDMA hasn't been approved yet.
And
however,
why did you have to also work with the FDA even though the studies were in Canada?
Oh, they were in Canada. A lot of the, I feel like a lot of what Health Canada does is they kind of look to the FDA. So I was just looking at what the requirements were for me to kind of read up, see what the requirements were, and just like compare that to Health Canada and, use some of the same resources because they all follow like international guidelines. There's this international code of harmonization guidelines and good clinical practices that everybody in the world should follow for clinical trials. So reading up on all of that, and yeah, the FDA kind of helped me do some of the stuff for Health Canada.
Very nice. And so when you mentioned some of the restrictions in the screening, questions and the screening process that you go through currently, why would cardiovascular risk and what kind of family history and mental illness do you think would not be a good fit for this kind of retreat center?
Yeah, so if you look at all of the clinical trials, you can go on and kind of look them up online, and you can look at the inclusion, exclusion criteria. If you have contacts, you can ask them for your protocols. And so when you look at psilocybin specifically, that's the main one that I work with. The main effect is on the cardiovascular system. So they saw in some of the trials that some of the side effects were like a transient increase in blood pressure and heart rate, and also like reports of anxiety and fear were also reported with some of the trials. So that's why cardiovascular is something we look out for. So serious cardiovascular events, and things like blood pressure and stuff. So you just kind of want to monitor that. It all depends on how severe it is and what your condition is, if you would be a candidate or if it's something that we would just want to monitor.
Right. So in terms of, I don't know if you've studied ayahuasca, but that's like the traditional psychedelic plant brew of 2 or more plants, and one of them acts as an MAO inhibitor, and the other one actually has the psychedelic properties. So, one of the big things is that tyramine containing foods should be avoided because of the MAO-I interaction with them, and which could result in hypertensive crisis. So are any of those kind of diet special requirements also recommended for psilocybin, or is it just like come as you are?
Yeah, for the psilocybin, I feel like I would recommend, I think for certain, it depends on what the supplements are. So it depends on how long the person's on them. I don't feel like there's any special diet, but I would say just to have a good preparation and a good mental space for a psychedelic experience, you'd want to abstain from, things like alcohol, nicotine. You probably want to prep your body for the experience. So is there any, of course you don't want to be taking alcohol with, psilocybin, but there's no special like dietary restrictions that I know of.
Yeah, there's a whole like protocol with a month-long dieta in the terms of drinking ayahuasca, to just like also make your experience as positive as possible, and kind of clear your mind and body from different types of toxins and other things that can affect your neurotransmitters. Um, and so what do you kind of have like a prep protocol for people like once you accept them, and what would they expect usually for this psychedelic experience? Would you say a lot of them have visions, or like what did you notice as a common theme?
I don't think I can go into specifics necessarily with what we do at over there in the Netherlands, but everyone I feel like has a different type of experience, on a psilocybin. So some people, the perceptual changes, so colors, some of them can have hallucinations. Some people have the mystical type experience where they, I don't know, like meet with an entity or some kind of mystical type experience. So I feel like it's different for everyone. Some people are laughing, some people are crying, and yeah, you never know what their experience is like unless they share it with you.
And so what, in your opinion, would be the benefit of going to, let's say, a guided retreat center that you work for versus just going into the store where it's legal and buying a truffle?
Or I think, yeah, I mean, first of all, you want to make sure you're an appropriate candidate, for psychedelic assisted therapy. And the preparation, I think, is really important, because I feel like if you're doing this, you really want to go in with intention.
Mm-hmm.
You want to be prepared for some of the things, because another common thing is feeling like you're dying.
Mm.
And that can be pretty scary, so kind of want to explain that, hey, these are some of the things that people experience. This is one of the things that you can experience. Some people experience anxiety, and with the preparation too, you kind of want to try to be as open as you can and lean into stuff instead of fight it. So that can maybe make for a challenging experience. So you really want to make sure you're prepared, because yeah, these things, if you're not prepared for it, it could be quite scary. And I think that's what can lead to all of these people, maybe having, they call it bad trips,
Mm-hmm.
when they just take it themselves without anybody kind of there, without realizing, what they're kind of getting into. So I think that's important. And I do think it's important to have somebody there who is somebody that you trust, in a safe space in case things do come up. So maybe someone can like hold your hand, be there for you, just knowing that you have this like trusting presence there. And then the integration is important too, because whatever happens, you want to make sense of your experience. And I think it's important to really take that and try to implement what you've learned from that. And most of it, I feel like people already kind of know what's there. It like makes it more like clear
Mm-hmm.
in maybe what you need to do. And so I think it's helpful to have either a therapist or some kind of wellness coach, somebody to help you make sense of it and, guide you into integrating that experience so you
Yeah,
can maintain the benefits.
absolutely. All of these recreational self therapies that you mentioned, like with cannabis or different types of mushrooms or even ayahuasca, people can have bad trips if they're feeling unsafe or they're not in a supported environment, because things can come up to the surface, like you were saying. And so ayahuasca traditionally is a ceremony. It's a community of people that are all doing the same thing, and they have this common intention, which is what makes it so powerful. And you have traditionally a shaman who guides everybody, and assists people that may need help. So it's like you're all in there together. And I've definitely heard the benefit of having such a person who knows exactly what to do and how to help everybody in the ceremony. And so, I think that's really, really important to have somebody that you can trust to be there. And definitely some trips can be, from what I hear, scary. And when you mentioned death, I definitely heard the term ego death a lot when, taking any kind of these kind of medicines. And what it does is it basically dissolves the sense of you as a whole, but it connects you to everything else that's around you. And so it can be scary, but also in a way very opening, like you were saying, and beautiful. So there's a lot of research that I would advise for anybody that's considering any of these types of medicines. So doing your own research and choosing a center or a retreat group, or just researching from other people that have done it and asking what their experience was like and which centers they would recommend, rather than just doing it at home by yourself without any support.
Yeah, I definitely would not recommend doing it, alone by yourself, especially if it's your first time doing psychedelics. And yeah, I really, I think people should go out and get educated about it if they're interested. And you need to really research the quality of the retreats, because there are a lot of ones kind of all over, the world, where I think people are doing it where maybe it's not legal. They're not doing adequate screenings.
Mm-hmm.
So, some people who may have been admitted to, one retreat would have been denied at, the one in the Netherlands retreat, because we're quite conservative. So yeah, that's really important to make sure it's like reputable, that, word of mouth, if you've heard people that have gone there. And yeah, you can look at like Johns Hopkins they just opened a whole center dedicated to psychedelic research. So they have a lot of information. MAPS does, the Imperial College of London has done a lot of stuff. So I have a page on my website called Psychedelic Medicine, and I'm trying to list like reputable retreat centers there, some of the top centers around the world that study psychedelics. So, and then I have a couple of articles that are peer-reviewed, open access articles.
Awesome. I'll definitely link to that in the show notes. And I also want to ask you, you mentioned LSD a couple of times. So in your opinion, why do you think that kind of failed? It was an experiment where we also, in the mainstream pharmaceutical companies saw the benefit of these psychedelic entities, and we decided to make a drug out of it and purify it. And so it was studied, but then everything was kind of abandoned ship because of like really bad side effects. So why do you think that happened?
I think the research that they were doing back then, they didn't have the same maybe like standards or regulations. So maybe they were doing some more risky studies. It was just, I think it's a different standard now with the clinical trials. And I think too, with the stigma, I mean, I do feel like these medicines open your mind, in addition to helping maybe treat depression, anxiety, trauma. I think they do kind of open your mind and make you question things and think about things. Think about what's really going on in life, what really matters to you. And so I don't know if maybe that was threatening to some people. I think there was the whole anti-war movement and all of that stuff going on. So there was a lot of, I think, political things that just kind of led to the war on drugs. And I think that's another thing that, I think we need to stop the war on drugs and decriminalize these substances.
Yeah, I think Portugal is the only country where all drugs are decriminalized. So that would be interesting to compare like their mental health spectrum versus the rest of the world.
Yeah, it would be. Yeah. And I think the psilocybin is decriminalized now. Oakland, California, Denver, Colorado passed something, and now in Oregon, they are working on a psilocybin initiative. I think they're hoping to vote on some kind of legislation that in 2023, they would be able to offer psilocybin-assisted therapy in clinics to people. So that's really exciting to see if they get that approved.
Yeah, wow. This field is definitely super fascinating, and I want to thank you for spending this time talking through all of these amazing things. And I have like a ton more things I could ask you, but if you just have a couple more minutes, I have some last rapid fire questions for us.
Yeah, sure. Sounds good.
Okay. What is your number one advice for people to improve their quality of life right now?
Right now, I think definitely movement, meditation, and periodic like reevaluation of what you want.
Awesome. What is your advice for pharmacists or pharmacy students that are interested interested in thinking outside the box and pursuing non-traditional approaches and doing something new with pharmacy?
Yeah, I think there's so many opportunities as a student. That's when you have your chance to explore all of these different niches in pharmacy. So I would recommend, if you can, set up your APIs to include non-traditional rotations, because that's where you really get exposed to see if it's something that you like. Networking is so important. I didn't appreciate that when I was in pharmacy school, but I realize now it's important to network, job shadow someone, at a non-traditional pharmacy, or reach out to somebody if you're interested in clinical trials, someone who's in regulatory affairs or medical science liaison. Just reach out to them, talk to people, and yeah, don't be afraid.
Yeah, love that. What is your favorite hobby or pastime?
Favorite hobby or pastime? It's not really a hobby, but I really love traveling. I try to do it as much as I can. It's been hard now with the COVID, not being able to go anywhere, but it's one of my favorite things. Just, I don't know, taking a trip outside, up north, abroad. Yeah.
Awesome. And what is your favorite beverage to drink?
Beverage. I'm trying to stay away from caffeine. So my drink of choice is like a chai latte in the morning. So tea. I'm getting into teas.
Awesome, awesome. Okay, and lastly, can you tell the listeners how they can get in touch with you and learn more about your work?
Yeah, if you want to get in touch with me, my website is dremilykulpa.com, and you can contact me through there or subscribe if you want to get in touch.
Awesome. So yeah, I'll link to that and the website page that you mentioned in the show notes. And thank you again for coming on. I had a blast talking about this fascinating topic with you.
Yeah, thank you so much for having me on. It was fun.
All right, enjoy the rest of your day.
Thank you.
Bye. Thanks for tuning in to another episode of the Raw Fork podcast, and I truly hope that you enjoyed it and learned something from it. If you did enjoy it, please don't hesitate to leave us a 5-star rating and a short, sweet review so that other listeners can find us across podcast platforms. To get in touch with me, you can go to rawfork.com or email me directly at marina@rawfork.com. Thank you, and I hope to see you back here next week.